Okay, good morning. We are on Shin Chaf Chet. We are starting Yud Aleph. Just a quick recap from yesterday. Couple quick things. So as far as dental pain, someone has dental pain, just to restate it. Now, the facts are it's rarely pikuach nefesh, dental pain, but it really depends on the situation. So obviously until you get it assessed, the patient usually wouldn't know. Usually antibiotics and pain medication is more than sufficient treatment for the same day, as far as pikuach nefesh is concerned, but sometimes it is best just to have it extracted. So I guess bottom line, perhaps a good rule of thumb is if someone is in severe pain and it cannot be controlled, then we do consider it pikuach nefesh, you're mechalin, you go to the dentist to figure out what's going on, especially if there is an obvious abscess, and especially if one has fever. And then, based on what's needed, then that's the appropriate procedure. Mama, we says best to have a goy take it out if it needs to be extracted, but halacha l'maisa, if it does need to be extracted, if pain can't be controlled, it's an abscess, then even a Jewish dentist is allowed to take it out. So bottom line is it's definitely, nowadays we all consider it a refuah yadua. It's a proper known refuah. And just to recap on delaying treatment, just to make sure it's clear, that's from Sif Daled. Let's say you know for sure the surgery or the treatment can be done after Shabbos, and there is definitely no problem whatsoever. So then, and it won't make any issues to delay the treatment till after Shabbos. So in general, we do say you have to wait. You're not mechal Shabbos if there's going to be no benefit. That's only if you're sure the doctors tell you it's not going to get any worse and there's no benefit. If the person will immediately start getting better on Shabbos by doing the procedure on Shabbos, so then the Meiri, it's quoted in the Bir Halacha, probably it's better to do it on Shabbos. If a person can't wait and it must be done on Shabbos, then there's no, it's not Nishmas Avraham, there's no point to wait. Don't wait a few hours. Sometimes you can wait a few hours and there's no difference. But once it has to be done on Shabbos right away, then he says, okay, don't wait. Anyway, everyone points out, obviously, if the surgery is going to happen after Shabbos, there's no absolute need, then you shouldn't be doing preparation that's Yisur Deraisa on Shabbos. I think that goes without saying, unless you get a goy to do it, etc. Now, relaxing a patient, also just to clarify, Yishuv Adas, for a patient to be relaxed, who's not relaxed, and he is a chola sheyesh bo sakana, so that is also part of mechalin. You're allowed to do things for him if he says he needs it done, or he needs it done, or he won't be relaxed. Then, and he is a chola sheyesh bo sakana, then you do for him even Isur Deraita. Okay? And we mentioned, I think that's it. We mentioned the other thing already yesterday. And just something on the side, I think we really may have said this before, taking temperature, for a fever, or taking the blood pressure. So even though normal measuring is asr on Shabbos, you're allowed to measure for refuah purposes. So in general, it's 100% mutter to use, and it's not muksa, that's in Shemina Shabbos Kilchasa, to use a thermometer and take your blood pressure. Obviously, if it's digital, that's a separate issue. But if it's not digital, there's no electronics, then there's no problem. Okay. I think we're good to start. Let's continue. Yud Aleph. Chola sheyesh bo sakana. That's where we are, right? Chola sheyesh bo sakana. Person is, right, we're still dealing with a chola who has a sakana. She'amadu b'yom HaShabbos tzarich la'asot l'rafua yedua sheyesh ba melechet chilul Shabbat shmona yamim. So he is a chola sheyesh bo sakana, and we're talking about a normal case when you should get started immediately. You shouldn't push things off, unless of course you have expert doctors telling you there's no reason. It's a procedure that could happen within the next 3 days. So then obviously then we said you should wait. But normally, we're talking about a case when you're supposed to start right away. So let's say it's an 8-day process, and we're talking about Chol Shabbos. So then, even Deraisa, So, ein omrim namtin ad alayla v'nimtza shelo yechalel alav ela Shabbat achat. Because it needs to be done 8 days in a row. That's the situation. So if you start today on Shabbos, you're going to end up having to be machal 2 Shabboses, right? 2 Shabboses within 8 days if Shabbos is the first day. So you might think, let's just wait a day and then we'll start on Sunday and then you'll only be machal Shabbos once. So then you should just know that's not kal chil Shabbos. We don't say to wait. So that only one Shabbos gets violated. No, you have to do it immediately. Even though you end up desecrating 2 Shabbos. Okay. Yud Beis. Now, this is interesting. Shabbat al chola sheyesh bo sakana. So now you have a case, a chola has a sakana, so it's a mitzvah to be machal Shabbos to take care of him immediately. So we say, mishtadlin shalom hasad ayidei ein Yehudi. So the Shulchan Aruch quotes the first opinion that says, you should not get a non-Jew to do it. Or ketanim, don't get kids to do it. V'nashim, don't get women to do it. Ela al yedei Yisraelim gedolim u'bnei dat. You want to make sure you get proper Jewish men, bnei das. Everyone knows they have a good mind, they're smart, and they're not going to fool around or be slow with the issue. However, the issue of bnei dat is, you want to make sure it's someone who's capable, quick, and fast, and you want to choose the man. Why? This shows that it's a mitzvah and it's a chiyuv to take care of the sakana immediately. Everybody else has other issues. Either the other issues will give the signal that, only a Jew can do it, or really it's usher, give it to a kid or give it to a nashim. And you might learn that since you don't have the rabbi do it, or whatever, the president, or just, any smart man, then you might give the bad impression. Also, what can happen is, you get someone else to do it, that takes time. Getting someone else to do it, explaining what needs to happen, that can also slow down the process. You might end up looking for somebody, or right now you'll see the guy is right next to you, but then the next time it happens, someone will learn that, it's really better to get the goy, let me go next door and get the goy. Or whatever, katan, whatever the case is. So all these issues, or people might think, so then it's not a big deal to be Mechala Shabbos the other way. For all kinds of reasons, it's better just to get the one who's going to be quickest, most responsible, and get, generally it's preferred a responsible man. V'yesh omrim. The im efshar la'asot belo dichoy. If you can, now the other opinions, a little bit of the opposite extreme, is if assuming there's going to be 0 delay in the matter whatsoever, so that you have to be sure about. Ubelo ichor al yedei shinoi. It's not going to get pushed off, it's not going to be delayed. Ose al yedei shinoi. Then you should do it through a shinoi, not in the most direct manner with your hands or whatever. So that's a question. V'im efshar la'asot ayidei ein Yehudi belo yichor klal. Or to get a non-Jew. So the Ramah points out, if there's going to be no delay, he prefers a shinoi or a non-Jew. And then, osin al yedei ein Yehudi. So then if you can, ein Yehudi is the best. And he says that's the minhag. But if you're going to worry that maybe the non-Jew will be a little bit lazy and delay, then you shouldn't do through a non-Jew. And I'll just point out the Mishnah Brura points out that the Taz holds it's better to have a Jew do it, not like the Ramah, because a Jew is going to be more zariz, he's going to be quicker. And the Shulchan Aruch Harav, it's quoted here, that says it should be
The Shabbos is related to a higher value for life.
I don't know. You have to see the Taz, I don't know. But he felt that it's not a real minhag, and that's the Ramah's opinion, but he felt, and also it may depend obviously on, where you live and which type of non-Jews we're talking about. And Shulchan Aruch says it's not better to get a Jew, always better to get a Jew to do it. Okay, so this way you don't learn, it basically follows the opinion of the Shulchan Aruch, the Maran, Chaber. So, different opinions, not clear cut. Okay. Yud Gimel. Kol zariz lechalel Shabbat b'davar sheish bo sakana harei ze meshubach. Whoever is quicker to do the Isur Deraisa of Mechal in Shabbos for this person is more praiseworthy. Afilu im etaken imo davar acher. Now, by doing it quickly and efficiently, you might end up doing a side Isser Daraisa. That's completely not necessary. It's still, you should do it quicker, and don't worry about it. Because you have to focus on doing what needs to be done for the chola. Kegon, sheparas mitzidei la'alot tinok shenafal lenar v'tzad imo dagim. Let's say you throw a kid falls into a river, a pool, and you want to pull him out. If you want to use a net, a large net, with the child or the baby, might come some fish with it. So he says, for sure that's not a problem. V'chen kol kayotze bazeh, and so too any other similar type of thing. I'll just mention one other example the Mishnah Berurah brings. Let's say you have a baby or maybe a really young child who gets locked in a room and the door's closed. So you have an option. You can break open the door and you'll end up with little pieces of wood that comes apart and issues of soter. You might even want the pieces of wood and use them for a fire later or a toothpick, whatever your issue is. But since your purpose is to save the kid, the baby, you should break the door and don't worry about trying to give him noises or throw him nuts or music and trying to delay the matter, because we're talking about a child who is going to be very nervous. And if he gets overly nervous and anxious, that can be dangerous for the child. So, okay. Fine, let's go on. Yudalit. Haya choleh sheyesh bo sakana. Now, we're still dealing with a choleh, he has a sakana. Tzarich basar, and he needs some food to eat, he needs some meat. So what do? Shochatim lo. He shacked for him. And it makes no difference. We're going to see the whole sugya in a moment about marbe b'shi'urim, not to make more than you need to. Even though it's mutter to do an amount, it's aser, either deraisa or derabanan, to do a greater amount than needed. We'll see that in a sec. But when it comes to shechtin, it's one life. So if you're going to have to, it doesn't matter if it's a big animal or a small animal, then it makes no difference. That's what I've seen. Shochatim lo, so then you shacht for him. Don't worry about it. He needs the food. Ve'ein omrim nachilena nevela. Don't say, wait, it's already shachted. I have the goy next door, or the market, whatever, and I can just get you some treif meat. And that we don't have to do shchita. So it's better to shecht once than to feed him nevela. Aval im haya cholet tzarich la'achila la'altar, but let's say you can't wait for the shchita. The shchita process, I don't know, but probably takes anywhere from 1 to 2 hours. I don't know if you could, well, it depends also chickens or meat, but okay, probably not less than half an hour to get it ready. Between the whole process. So anyways, aval, so you want to eat right away, and obviously the situation could take much longer. Aval, nevela is right here. It's from the fridge, ready to go in. V'ashchita mitacheret lo, and the shchita is going to take much longer, or even longer. Ma'achilin oto hanavela, right? Obviously a few minutes is negligible. I don't know. Whatever, it's a significant difference. Ma'achilin oto hanavela. So then don't worry about the shchita, just get the food cooked and give it to him. Or maybe it's already cooked even quicker. So that's the nevela. Couple reasons given. So one is, so there's a whole machlokas, just to mention it, not going to discuss it in detail. It's machlokas Rishonim and Achronim. How to deal with Shabbos when you need to do something for a chola. Do we call it dechuya or hutra? Is it like now everything's 100% mutter, or do you also marbe b'shurim is still an issue, or is it just you have to do as little as possible? Okay, so that's the reason. Mm-hmm. Right. So that's one reason why it's better to do shchita, because it's hutra. That's one opinion. Another reason is shchita is just a one-time deal. You shecht it, and now pretty much everything else is mutter, or almost everything else is mutter. Anyways, there's not too many yisurim. By nevela, every kazayit is considered another iser. So that's another reason that's given. Another reason that's given is if you give the nevela to the Jew, he might say, I'm not eating treif. And so you wasted your time, and now you got to start all over again to get kosher meat. Because he has to be willing to eat it. Mishnah Berurah points out, interesting, for a katan though, better to give him nevela. Because shchita is an iser daraisa. So for a katan, if you have a choice, so that obviously if the katan does his own shchita, assuming he can do shchita, It's a whole separate issue. But since a gadol is going to end up doing the shechita, and the gadol is somebody else who's doing an issa d'oraisa for a katan, better just to give him nevela, and because he's eating himself. So that's much better. Okay. Again?
Do you do kisui hadam if you're doing shechita on Shabbos?
Okay, so let's wait kisui hadam for Yom Tov, because that's when it comes up on a regular basis, and so that's a little bit of a machloket. In general, if you had, I'll just say real quick, if you had the dirt ready to go, then of course you would do kisui hadam, because there is a mitzvah to do kisui hadam on Shabbos and Yom Tov. But the question is by muksa what to do. Okay, so let's discuss later. Tet Vav. Amadu perush hitbonenu b'machlato v'shiaru harofim shetzarich grogeret achat. So okay. Now, so this is the next two simanim in particular, marbe b'shiurim. So now the doctors say you need to get one. What's the grogeret again? The dried fig from the tree. You have to cut it off. So he says you need one. Well, I guess it's not dry yet. But anyways, usually it is when we talk about it. But anyways, you need one. You need to get one off the tree. V'ratzu asara. And 10 guys ran to go get it. One second. V'ratzu asara v'viu lo kol echad grogeret kulam pturim. If 10 guys ran to do it to get to 10 different trees, and they all went to do it for you, they're all pater. V'yesh lehem, I mean, it doesn't matter if it's 1 tree or 10 trees. It's just, in other words, if they all know about each other, and they all know they're all going to arrive at the same time, then obviously that's aser. We're talking about each one thinks that they might be the first, they're going to be quicker than the next one, and since each one thinks they're going to be first and the most useful for each one, not only are they pater, v'yesh lehem sachar tov meit Hashem, afili hivri barishona. Even if they're number 10, and the first one was all he needed to eat, then they all get the schar. Because when they did it, they didn't know who's going to be first or how many he's going to need. And so they all did the mitzvah. Ted Zayin. Amadu l'shtei gargarot. So now the doctor says, no, he needs 2. So v'lo matzu, so what's the choice? V'lo matzu ela shtei gargarot b'shnei uktzim v'shalosh v'oketz echad. So now you have, it's on one little branch or stem. So you have one that has 2, or 3 actually. The first case is you have 2 and they each only have 1. You need to take down 2. And you have 2 branches, let's say, and each one only has 1. So you can cut off twice to get 2. Or you can have 1 branch or stem and it has 3 on it. So you're going to end up getting more figs, but you have 1 maisa, 1 act of doing ktsira. So then what's the, I don't know if it's obvious or not, let's read. Korti ma'oket sheyesh bo shalosh. So then you should definitely cut only once. Because 1 ktsira is doing less averas than doing 2 ktsiras. Thank you. So even though you're going to end up with 3, it's better to do 1 maisa. V'ima yushtei be'oketz echad, v'shalosh be'oketz echad. Now, let's say you have 1 with 3 and 1 with 2. So both choices are you're only going to do 1 act of ktsira. So you can take off 1 or you can take off 2. Take it back. You're only going to cut once. 1 has 2, 1 has 3. And all you need is 2. So then, lo yechretu elokat sheyesh bo shtayim. So you have to only cut off the one with 2. Because even though you're doing 1 act, we still say marbe b'shiurim to their deraisa derabanan, but we still say you're not allowed to add extra. Even though you're doing 1 act, cutting off 1 branch either way, you can't get 3 out of it when you only needed 2, if there's an option to get 2. Haga. V'ima davar bahul ein medaktakin b'kach. Now, if you're nervous, or you're all stressed, and it's too hard to pay attention and start counting, and there's leaves in the way, and don't waste time. Don't let yourself get slowed down. So often, it may not be relevant depending on the situation.
It sounds like the matter is urgent. A person came to you and said,
If your head is straight and you can do it quickly, then there'll be no difference. Then you should not violate Marbe B'Shiurim. Okay. Maybe you could read it that way also. But, and Mishnah Berurah points out that applies to all malachos too. Let's say when it comes to cooking. Let's say you're allowed to cook in a pot. You want to cook, chicken soup, meatballs. And all you need, let's say meatballs, all you need is 2 meatballs. But in one pot, you turn on the flame once, you can cook 10 meatballs. So he says it's the same isser of doing marbe b'shiurim. So you could only cook what you need. Now, if you don't know how much you need, you're allowed to cook as much as you need to get yourself out of, you don't know how much the chola is going to eat on Shabbos. But once you get beyond that point, then it's aser. Okay. Fine. Next. Yud Zayin. Chola shenafal machamat chol yol mishkav ve'ein bo sakana. Okay, so now we're dealing about a case. We're going to go back and forth a little bit. Right now we're dealing, for now we're going to be dealing with the case of a chola she'ein bo sakana. Nafal mishkav. And, okay. So now, we don't do malachos deraisa, so we'll see. Also, just to point out, we learn that let's read a little bit more. Haga. Or you're mitzvah, and your whole body got, feels terrible. Yeah, so, in other words, you don't mamish have to be lying down in bed. If you're sick and you need to lie down in bed, but you can push yourself. Go to the kitchen and get something. You're sick like a dog, and some people go to shul anyway, or whatever you're doing. You have to go to, some people, whatever the issue is, if you're sick and you should be lying in bed and you feel like you need to lie in bed, but you're not, that's still considered this level of chola, where refuah now becomes mutter. Okay? Now, omrim le'ena yodi l'aseh lo refuah, you're allowed to have the non-Jew do any kind of refuah that you need, even a refuah that is deraisa. He's even allowed to cook for you, as we're going to see. So you can ask a goy, even though there's no sakana over here, you're a chola, you're a regular chola, and you're allowed to have a non-Jew do for you anything that you need, even a malacha deraisa. But you yourself, the Jew, cannot do an issa deraisa for this person. Even if a person has a sakana to one of his limbs. Now, we learned that there are cases when, even by a sakanas aver, we say it's pikuach nefesh, anything generally where there's trauma, infection inside the body, or also any case that a doctor tells you that if you have an injury inside the body and you don't take care of it, then it could lead to pikuach nefesh. So already now you're allowed to be we treat it as sheyesh bo sakana. If you have something that can lead to it, obviously at some point anything can lead to anything, but within reason. If the doctor, anyways, within reason. But okay. So what are we saying? So you're allowed to have we just mentioned, so a non-Jew can do it for you. Also, even if it's okay, fine. Ulachalal alav Yisrael be'isur derabanan biyadayim. What about a Jew? So you have a chola, you're allowed to do refuah for him. Can you do an isur biyadayim that's derabanan? So this is the general rule. We're going to read about 3-4 opinions, and the halacha follows the third one. I'll point that out when we get there. So, just a couple other opinions first. Some say a Jew can do any isur derabanan that he wants with his hands regularly, if for anyone who's sick. Okay? Some say it's real simple. If there's a sakanat aver, you can do any isur derabanan. There's no sakanat aver, you can't do anything. You can do a refuah that doesn't have involved in it an isur derabanan. V'yesh omrim, and this is the halachic opinion, accepted. She'im ein bo sakanat ever osin b'shinui. V'im yesh bo sakanat ever osin b'lo shinui. So the general rule is, if a person is sick, you can do any Isser Darabana. Person has a din of a chola, even if there's no sakana whatsoever, a Jew can do any Isur Darabanan. One caveat here, if there's a sakanat aver, you might lose a limb, then you can just do it regularly. You don't have to think twice about using your hands funny or doing anything out of order. But if there's no sakana aver, so then a Jew could only do it with a shinui. Okay? Has to do it with the back of his hand, or his fingers funny, or something done with a shinui. V'yeshomrim, afilu yesh bo sakanat aver, eno sin lo davar shu nismach lemalacha deraisa. And the last opinion is, which is not lahalacha, that even if there's sakanas aver, you can't even do an Isser Darabanan if it's modeled after an Isser Deraisa. V'dvarim she'en behem samach lemalacha, osin afilu ein bo sakanas aver. But anybody holds, if it doesn't resemble a malacha, then it's okay. V'divrei asvara hashlishit enirin. And the third opinion, which we highlighted, that's the third one, second to last one. That's the one that's accepted the halacha. It's both mentioned by the Machaber and Mishnah Berurah as well. Haga. Mutar lomar le'en Yehudi la'asot tavshil l'katan she'en lo ma le'achol. You're allowed to tell a non-Jew to take care of feeding a katan who doesn't have what to eat. The stam tzorchi katan kechola she'en bo sakana dami. There's normal needs of a katan. We consider it to be like a chola that is not in sakana, unless he is in sakana. But a stam katan, we consider it like a chola she'en bo sakana, and therefore a goy can take care of it. V'kol she'asur la'asot ayidei Yisrael, afilu ayidei achola be'atzmo asur. And whatever is asur to do through a Jew, afilu ayidei the Jewish chola himself also can do. It doesn't make a difference if it's the Jew, the chola himself, or someone else who's taking care of him. For this category, we say a chola she'en bo sakana to do an Isser Darabanan with a shinui. Or if it's sakanas ever, then regular. But if the non-Jew's doing it for this chola, mutar lachola l'sayeo ktsat. We mentioned this before, that an Eini Yehudi is allowed to even help him a little bit. He's allowed to help the chola himself is allowed to help the Eini Yehudi by like tilting his head or blinking his eyes or the like. The Messiah ein bo mamish. Messiah is not really much of a malacha, and it's not asa. At least in this case, and perhaps in all cases except by shaving razor for hair.
Bishel's permitted?
Yeah, bishul is. Bishul is permitted for the katan, definitely, and we're going to talk about that exact case in tomorrow, Sunday.